So today I had physical therapy the first time for the ulnar nerve transposition, however you want to call it. And it was supposed to be a really easy day, and it wasn't. I mean, I barely did anything. I just sat there and let somebody, one of my physical therapists, just stretch, str- stretch me. And what I originally thought was for the first day, okay, we'll see where my flexibility is and everything like that. No, she realized that, I don't know if y'all can tell, but that's as far as my arm can straighten right there. And I'm having atrophy already, but since I wasn't able to work out before, it's just fat right now. But because I can't even flex. I mean, that's the most I can flex. But it's so tight right here that I can't. My bicep is making it so it's not that my tricep is. And what I should mention is they cut part of my tricep right here. They cut part of my tricep. It was probably about that much of my tricep that they cut off. Probably about, that's the width of it, but it's probably about that long. And so I was like, okay, go in, see how I stretch. And the best thing I've ever had for like getting mobility or flexibility back, because I've had like 4 knee surgeries. I had my first rib taken out and the pec minor done at the same time. And then this. But with my knee, I just put the brace at like maybe like the most that they would let me go. And I just hang it off the bed. So that's what I'm going to be doing with my shoulder or with my arm. And they told me about it, that basically that's what we were going to do today. That's what was written in my notes for the physical therapist. What she did was, which I don't mind, I actually like, because I can feel it getting a little bit more back. I mean, 2 weeks after surgery, that's not bad. Trying to get straightened wise. And I can get it. I just woke up, so this is as straight as it can go right now. Later on in the day, I can almost straighten it completely up. But what she did was, so she took our marble, put some lotion on, put a marble, pushed it in to my vein, or into right in the center mass of my arm, which I think it was right on the vein going all the way up, and all the way up to my neck. Because I don't know if y'all can tell, but you can't really tell. But this is really tight. It's been tight since I had the first rib resection taken out. And it's just a really complicated procedure, because this showed up after I had the rib resection. And what they have to go in and do after this, because I'm at the second part of the three surgeries that I needed. And the first surgery I had, it was back in August of 2016. And I kept trying to get this elbow part taken care of right away. But every doctor wanted me to go do more nerve tests. I already had a nerve test done. And they wanted me to do more MRIs with injection, which I don't know if y'all know the contrast. When they put the contrast in, that screwed up my nerves in my neck so bad when they put the contrast in right here, and they put it right in the shoulder joint. And I was not going to go through that again. And not just because it's painful. I was sweating like a whore in church the whole time. And I actually took the needle out myself. I was like, no, y'all are done. while they still had it in. I was like, y'all keep hitting the same spot and y'all can't get it completely inside the joint, but y'all are just moving around inside. They kept hitting the joint, but they couldn't inject it for some reason. And I was laying there perfectly still. But they wanted to do that with my elbow. And I already did a nerve test, which, if you have nerve damage, is the most painful thing in the world. Because it'll set off your fingers like they're on fire. And so I didn't want to do that again. And first off, when I first started this process, first 3 months were lost because no one knew what it was. I had symptoms of losing I started losing all feeling in my hand. And then I had to hold a tablet in this hand all day because I couldn't feel with my fingertips to be able to use the tablet on the other side for work. So, and then what they decided to do was, oh, your neck is in so much pain, let's just put lidocaine cream on it every day. Which I don't know long-term side effects of having lidocaine on your neck, right where the nerves and the veins are right there, your main artery. And so I had that done, or I went with that. 35 MRIs or x-rays in the first 3 months. They thought I had like a fractured neck because of the loss in function, loss in strength, and it would go throughout the day. I'd be really good in the mornings, and then I'd get to work, start working. About 3 hours in, I couldn't hold a tablet. I couldn't feel from my elbow down, and then I couldn't feel from my shoulder down. And the chiropractor was actually the first person that noticed it, because I went to him. I was like, okay, I'll just do PT. After a doctor said, oh, it's just a sprained AC joint. So they injected my AC joint, which made it worse. Then he was like, okay, you're return to work Monday. I was like, you just made it worse and you're telling me to go back to work. And mind you, I work with 18-wheeler parts, and we'll be putting stuff on 18-wheelers on an assembly line with my arms up the whole day. And you got to have both hands because you're putting parts on and screwing them in using air gun. So I couldn't do that. I'd be fired regardless because my quality of work would go down. And not just my quality of work, but the timely. And so that's what I need to go to physical therapy or something. And they went and did a test, made me do the chicken dance and all that stuff. And that was the first time that somebody was like, okay, you have thoracic outlet syndrome. And what it was they tested me. I went like this for 2 minutes, then put my hand down, and then looked at both my hands. My right hand was turning purple or reddish, like that's kind of normal because there's blood flow going to it. And my other hand was white, like Xbox controller white. And or paper white, if you don't know what the Xbox One controller looks like. So that happened, and then I had to wait 3 months to have surgery because there's less than 40 thoracic outlet syndrome surgeons that have a good reputation in the country, and most of them are in the Northeast. And I went to my doctor's in Dallas, and he's a great surgeon. And if anybody has any questions, if they're going through this, leave a comment and I'll tell you who it is. But because I'm in a thoracic outlet syndrome group on Facebook whenever I use it. I don't use it much, but so I had to wait 3 months because he was doing lectures about it around the United States. And I guess he took vacation then too, because he's booked all the time. And I went in, he goes, "Oh yeah. You could develop a blood clot because of this." Because I wasn't getting any pulse down to my fingers. If my arm was anywhere above right here, I wasn't getting blood to my fingers. And so after that, I had the surgery. Well, I went to go see him, and like a week later, I had the surgery. And everything went pretty good. Everything was good. But I had to stay in the hospital for 3 days. And didn't realize till afterwards, if anybody has to go through this, it's like having open heart surgery. Not the incisions or anything like that, but the pain. Not to mention the hypersensitivity. When you have nerve involved surgery, it feels like a sunburn. Everywhere where your nerve is going, what that nerve is coming and going to. So, like right now, I feel like I have a sunburn all over my arm. Constant sunburn feeling. And then like you have an itch on it, you scratch it, feels like you're scratching a sunburn. And so there's not a lot of people that know about this. And it's harder to find people to talk to about this. And but that group really helped me out, because there's a lot of people that I think it's like close to 1,000 people, and it's worldwide. And it's a lot of it is us being on our phones all the time, being at a desk, having a tablet in their hand. Everything, like job wise, if you're standing and this was part of my problem at my job, I was standing at a desk. I'm 6'2". I'm standing at a desk and at my job, it was a desk that we had little departments for shock struts, everything like that. Transmissions, but it's the desk that we're putting everything together, looking at the paperwork, is all the same height. And it's made for men and women. And you have to wear steel-toe boots, so I'm like 6'3" in boots. And this is made for people that are like 5'4". So I was constantly, my waist was taller than the desk. And of course it's the standing desk. We're not sitting at that job. So I was constantly, if I was getting something on the table or looking at paperwork on the table, and you have to mark out everything on the paperwork, that like checking your work type stuff. So you're constantly looking over at the desk, checking everything out. Didn't think anything of it then, didn't think of it till after the fact, how crazy that is for guys like me that are taller. And the hunched over part of it, you couldn't be, I'd have to squat to look at it without being hunched over. And so I was just thinking about that. But if you start having like feelings of your fingers going numb or anything like that, I just go see a doctor. Maybe go see a chiropractor. Even though a lot of people don't like chiropractors, but they can do tests. They can do, and not tests that are going to be, our physical therapist, not tests that you're going to be like in, most of them have x-rays too, to see if it's more than that. But you're not going to be, I'm trying to think of something. You're not going to be, you're going to find out right away. It's not going to be like, okay, come do this test and we'll find out in a couple days. You'll know right then. And then you have a plan right away. That was my biggest problem, was I was getting thrown all over the place. I was going to see like 4 different doctors. First thing they wanted to do, they'd want to do an x-ray or MRI. And I was basically, if this wasn't going to kill me, getting all the x-rays was. I mean, who knows how much radiation I got from that. But especially up here. I mean, they were right here doing x-rays all the time. And when I say 35 x-rays, I'm just talking about how many times it was a picture taken at a doctor's office. Not how many times how many times I went in the room was like 30 times. I'm not counting how many pictures they took. And then I had like 2 or 3 MRIs. So I would just go to a physical therapist or a chiropractor if y'all start having these symptoms. Mine was, I just started losing grip. I did a 360 on the highway because I was trying to turn the steering wheel, and I was braking like I was getting on the exit, and my hand wouldn't turn. The grip wasn't there. So when I turned, it just went over the steering wheel. And I had to hit the brakes. I did a 360 on 35 in Denton, Texas. And if you know how 35 is in Denton, especially at 3 o'clock, I was on my way to work. It was 3 o'clock. I did a 360 there. And then the pain of doing that 360, luckily didn't get in a wreck. Luckily, and I have a Jeep Wrangler, so I could have flipped that thing very easily. I don't know how I didn't. Jeep Wrangler Unlimited. I could have flipped it so easily. But it hurt so bad after that. And it was so scary because you now know that you can't rely on your own body. And when you get to that point, you just want it to go away. You don't care about anything else. You just want it to stop happening. And this has been like a 2.5 year, 3 year adventure for me. And it's been the biggest pain in the ass because every time you think you're getting somewhere, you're taking back you're 2 steps forward, 3 steps back. That's what it feels like all the time. So I've had both these surgeries and I have one more left, and that's when they basically gonna take my nerves. It's gonna be, I'm not looking forward to this at all. I gotta look it up. I think it's called it's like the brachioplexia, something like that. But it's where your nerve root is in your neck, and they're gonna have to get all the scar tissue that's out there. And I don't know if they cut the nerve or what they do. Oh, that just doesn't sound nice. But they get it so that, because when it's going down, when it goes through your collarbone, there's only like that much, the pinky size, like there's only like that much space for the nerves to go through. So if you have any scar tissue, you're pinching off the nerve and the artery. That's what was my problem. was pinching off the artery if I went anywhere above here. I was pinching off the artery and closing it off so no blood was getting down. But it's a lot of stuff, and I'll give more updates as I go. But there's not a lot of people out there that know about thoracic outlet syndrome. There's not a lot of people that talk about it on YouTube either. So, and I know a lot of people, like when I was looking for stuff, I couldn't find anything on thoracic outlet syndrome that I could watch a video, see how surgeries go and everything like that. I just wanted, and I knew about thoracic outlet syndrome since I think it was like 2008, 2009, whenever the Rangers pitcher Matt Harrison had the surgery. That's the first time I heard of it. I looked it up. But it's not like I went and I was like, oh, this is what I have. No, I went to a whole bunch of doctors thinking that it was AC joint, fractured neck, build up on my spinal column of, I forgot what they're even called, but when your spine is, like most people, it's like this, like knuckles. They thought mine were going out like that, so I was pinching the nerves and in my neck, and it wasn't any of that. I went to so many doctors and so many tests that no one can say, oh, you heard about this and that's why you had it. That's what you ended up getting. No. I never even heard of the surgery that I ended up getting. So, it all started, by the way, with knots in the back of my shoulder. That's how it all started. And I would get huge knots in the back of my shoulder from hunching over the whole day like this. I got knots all there. And what they said is, once I got those knots, I was favoring it so much that I was going like this everywhere. I couldn't bring it back. So everything got constricted here in scar tissue. And I had 2 weeks off for Christmas, 2015 into 2016 for work. And I was like, oh, I didn't think anything of it. I was like, oh, I feel so much better. Because this all started in October of 2015. And I had the 2 weeks off, maybe it was 3 weeks. The plant shut down for Christmas and New Year's and all that. And I was like, oh, I feel great. Like, you can see pictures like right before. I have pictures of me. And I was getting in pretty good shape from just being able to not hurt. And I wasn't working out or anything like that. I was just eating right and going on walks. And I was probably like 210. I'm like 240 right now. And, but everything disappeared for those 2 or 3 weeks. And then I got back, and I think we got back like January 5th or 6th. And that same day, I was like, oh, great. I got to go to the doctor. I can't do this job right now. And I got put on light work from the doctor. And I still had to do my job. And you can't be going through totes at work without 2 arms. And I was quality control. And so I had to check everything that was going out of that warehouse. And everything's in totes, and you got to check every single one. So, lifting up stuff and having a tablet in the other hand. But you still got to lift it up and count what's in there. But, so, I just couldn't take it anymore. So, I'm rambling now. But if you want Want to know the Facebook page? I think it's just Thoracic Outlet Syndrome, and on there. I'm Anthony Hall in that group. So if you want to add me on Facebook, I think it's a picture of me actually in a surgical bed after surgery, eating. Which I have like one picture that it's me of like a frown face, then me like, oh, that's not what I expected face, and I think that's my picture on there. But if y'all want to add me on there so that I could get y'all in the group, I think it's an open group. I don't know if it's closed. It shouldn't be. But I'll just keep y'all updated on what else is going on with, and if I have the next surgery, when I have the next surgery, and how it goes. So, all right, stay positive, everybody. Peace. Yeah, I have to say stay positive. I have to say it to myself all the time. So, and it helps. So, stay positive.